Okay, so today what we're going to do is we're going to discuss some positions or changes to the 90-90 position. The 90-90 position is something that's utilized within the functional range systems quite a bit. It allows us access to train the hips both in external and internal rotation. For today, we're going to primarily focus on the external rotation, which is the front leg that we're trying to train. So when we try and train the front leg, we have to first find tissue tension. Tissue tension is something that is going to be individual or unique to every individual. So what I'm going to ask Olivia to do here is I'm going to have her start to lean forward and to try and find a stretch on that posterior or backside tissue. Now, we're also going to give Olivia the opportunity to go through what we call tissue exploration. That allows her to find those different lines of tension. Traditionally, this exercise will be cued for people to stay over top of the knee, but for every unique individual, that may not actually be what we're looking for. So as we see here, Olivia's kind of just scouring to find different lines of tension on that backside. Once she finds one that's appropriate to her, I'm going to have her stay there. Now, in this position, I'm going to ask Olivia just to simply breathe in through her nose and out through her mouth nice and slowly. Usually on a 4 count in, potentially on an 8 count out. This is where we're going to start to allow that tissue to be primed for what we're going to do, Pails Rails. And I will explain that in a little bit more detail shortly. But as she goes through her breathing, if she gets space or that tension starts to dissipate, I'm going to want her to sort of take that different line. Now, once we sit here for approximately 2 minutes, that's a good enough time to allow that tissue to be primed. We're going to start what's called our Pails and Rails contraction. Now, this is often a very confusing component because they are acronyms. But what I want people to understand is that if I ask Olivia to do a Pails contraction, what's going to happen, if we're focusing on rotation, I'm going to have her try and rotate the foot into the ground and trying to create that motion through the hip. So she's trying to take the outside of her leg and rotate it in. What we're going to do is we're going to start to explore different irradiating tensions as well. So she's going to do that at 60%, 80%, and then we're going to do one max effort. Following the max effort, we're actually going to try what's called a Rails contraction. So I would have Olivia take the inside of her leg, rotate it out as if she's trying to lift the foot off the ground. It's almost impossible for her to lift the foot off the ground because this is truly her end range, so there's nothing going to happen. But it's the change in contraction that ends up being super important. So Olivia, are you in a position that you feel like you can produce a contraction and you feel strong in? Okay, so what I'm going to have you do is I'm going to have you start to rotate the outside of this leg and push that ankle into the ground 20%. I want you to find 40%. I want you to find 60% and hold. Now when I count you down, I just want you to slowly let it relax. 3, 2, 1, and settle. Good. Now we're going to take that one step further and we're going to find what a greater intensity is. It's not your max effort. We're going to take the next one to about 80%. So here I want you to do that same contraction. I want you to pack that air in. And I want you to start to take that foot and rotate into the ground 20%. Take it to 40. Take it to 60, which is just where we were. Now I want you to take it one step higher to 80% and hold. Again, when I count you down, just let it settle. 3, 2, 1, and rest. Now I'm going to ask for Olivia's best effort of the day today. So we're going 100%. You're only going to hold this for 6 seconds. But then what's going to happen is at the very end, we're going to try that Rails contraction. So you're going to take the inside of the leg, you're going to roll it out, trying to lift that foot off the ground for me. So here I want you to pack that air and get tight through the rest of your body. Corkscrew your hands into the ground if you need extra tension from the body. Start to take that foot, rotate it into the ground 20%. Ramp to 40. Take it to 60. 80. Now your safest, greatest effort and drive that foot into the ground. For 4, 3, 2, 1, and switch. Squeeze everything on the inside of that thigh. Try and rotate it off. Get that foot off the ground. If there's a scale underneath your foot, it's reading almost 0.1 pounds and ramp down. Good. Now, we're not running away. We still have some more work to do here because we were talking about that being from the rotational capacity. Now we're going to actually take that one step further and we're going to talk about what happens when we're trying to train linear tissue. Now in this one, all that changes is we can still undergo tissue exploration, so we can still find different lines of tension. But now I'm going to ask Olivia to have her contraction pushing the knee and ankle down into the ground at the same time. That's going to be her Pails. Rails is going to be as if you imagine someone taking a rope from the middle of the shin, trying to lift that shin and that leg off the ground so the ankle and knee come off together. Again, she's going to be far enough into her end range that there's almost going to be no potential for that leg to come off the ground. We're going to go through the same procedure. We're going to start with a 60%, we're going to ramp to 80, and then we'll do a full best effort with a Rails contraction. So Olivia, I want you to take that knee and ankle, and I want you to drive it into the ground 20%. Take it to 40, take it to 60, and hold. Shallow breathing, you're still breathing, and I want you to slowly ramp down. Good. We're holding that contraction for somewhere between 6 and 10 seconds. We're just trying to prime the tissue. We're just trying to get the tissue ready for what we're going to do at the very end when we go best effort. Now we're going to take that second set. So I want you to pack that air in again. I want you to push that knee and ankle into the ground 20%. Ramp to 40. Take it to 60. Find that little bit more at 80 and hold. 3, 2, 1, and ramp down. Okay, as we prepare for our best effort, it's 4 to 6 seconds. You're going to push as hard as you can, and then you're going to try and lift that shin off the ground. I want you to find extra tension, corkscrew those hands into the ground. I want you to push that back leg into the ground, finding a little bit of extra tension. Now, pack that air in, drive that knee and ankle into the ground 20%. Climb to 40, don't skip. Ramp it up, 60, 80. Now safest, greatest effort, push. Imagine someone's pulling your leg. Squeeze, 3, 2, 1, pull. Squeeze everything on that front of that groin. Try and lift, squeeze as hard as you can for 2, 1, and settle. Good. Now we're gonna actually have Olivia transition to the other side. But we're going to do this through an ISO MP. So we're going to do this once. I'm going to have Olivia drive her knee into the ground. As she drives her front leg into the ground, she's going to try and open up that back knee towards the opposite wall. Once she can no longer open that any further, only then can this left knee start to follow. And what we're going to do is we're going to try and create as much separation as we can. And as she keeps falling down, she's going to drive that front leg to the ground. And then once it hits the ground, she's going to use her muscles to pull that one down. Now on this side, it was previously established that we don't have as much range of motion. So we're going to utilize some options to find space here. So for a lot of people, during that tissue exploration component, they may find pinching on the front of the hip. They may find their spine is twisted in different weird ways. And we have to respect that space. So if we find that we can't be here or we're not comfortable, I may say to Olivia, let's try and lean out to the side. Try and find some space. Try and feel what's more natural. Once you get that lean going on, I want you to kind of explore that tissue forward again. Now, again, we're always checking in to make sure that there's no pinching on the front of the hip. If we get pinching or closing angle pain on that front side, we need to step back and we need to potentially get out of that area so that we can train in an area that we don't have issues. Now, once Olivia finds that spot, she's going to start to breathe again. She's going to let that tissue on that backside try and settle in. Again, as she breathes, if she gets space, she's going to take it. It may not simply be more leaning forward. There may actually be some rotation or gliding to the side for her to find what's best for her. we always have to remember that a kin stretch practice is just that. It's unique to what you need for that day. These are individual exercises that we utilize in kin stretch, but this is something that everyone can utilize in their training programs. Now, we're going to go through that same series, Olivia. Is this a comfortable position for you? Good. Okay. So we're going to start with that rotational effect. So you're going to take the outside of the thigh, rotate it in to push that ankle into the ground, and we're going to start with our ramping. So what I want you to do is I want you to take that intensity and I want you to start to roll that ankle into the ground 20%. Ramp to 40 and take it to 60. So I'm going to come by here and I'm going to try and lift your foot off the ground. Keep it there, hold, 3, 2, 1, and settle. Good. Now I'm going to provide a little bit more external feedback this time. So again, we're going to aim for that 80%. So what I want you to do is I want you to pack that air in. I want you to push that foot into the ground through rotation, 20%. Take it to 40, take it to 60, take it to 80, and don't let me lift that foot off the ground. Keep squeezing. Good. 3, 2, 1, and settle. Now, we're going to go into that best effort. So I want you to corkscrew those hands in the ground, find tension, push this back leg into the ground. Now I want you to start to push that ankle into the ground 20%. Ramp to 40. Take it to 60. 80. Safest, greatest effort, and go. Give me your best effort. Come on. Good. And we're going to switch directions in 3, 2, 1, and switch and push into my hand. Push. Squeeze out more external rotation. 2, 1, and settle. Good. Now I want you to search that space one more time, and I want us to find what we need for that linear capacity. So again, we're going to focus on the tissue that's a little bit more in the hamstring and groin area now. Again, linear being the fact that we're going to have her push that ankle and knee into the ground at about the same intensity. And then your Rails contraction, again, is imagining that rope that someone's lifting up in the middle of the shin. Now, we don't necessarily have to rest here again for 2 minutes because we actually took the time when we were doing that first exploration to spend time in that tissue. Now we're going to start just getting into our Pails Ramping. So I want you to take that intensity. I want you to drive that ankle and knee into the ground 20%. I want you to take it to 40. I want you to take it to 60 and hold. Shallow breathing. 3, 2, 1, and settle. Good. Next set, we're taking it to 80%. A little bit higher, a little bit more intense. Pack that air in. Push the ankle and knee into the ground 20%. Ramp to 40. Take it to 60. Find 80 and hold. You're not at your max effort. You're just holding. 3, 2, 1, and settle. Now, best effort of the day on this side of the limb. Really find your hands. Be strong through your body. Strong through the back leg. Start to take that ankle and knee and drive it into the ground 20%. Climb to 40, 60. Take it to 80. Now find your safest, greatest effort and hold. Squeeze. Imagine someone's trying to pull it off the ground. 3, 2, 1, and pull through the top. Squeeze as if you're trying to get that foot and knee off the ground. Squeeze. 3, 2, 1, and settle. Good. Because we did an iso-MP going the one direction, we should probably balance you and go the other direction. So again, in that transitionary movement, I'm going to have you start to open up that back leg. I want you to open up the back leg while pushing that front leg into the ground. Keep squeezing. Push into my hand. Good. Keep pushing into my hand. Now, when you run out of space, I want that knee to come. So now push into my hand as you come through. Keep pushing. Good. Keep fighting through that space. Good. Push this one to the ground. Keep there. Keep falling through and push to the ground. Good. And that's it.